of course, she's done many presentations in training doctors, both in South Africa as well as in Mauritius, and hopefully some of the other little islands soon, like Seychelles and Reunion and so on. So Melissa was a very young, well, she's still young. She was even younger when she went to Mauritius, and she set up office there for SciVision. And there's not too many dentists in Mauritius. There's only about 300 plus minus. Melissa could give us a bit more information. So it's a pretty tough market. And Melissa's been doing a sterling job there. And I just really hope that especially the dentists in Mauritius really appreciate having the caliber of a person with the education and training that Melissa's got. And besides that, Melissa's also participated in 3 Aachen University mastership classes, been directly trained by Professor Norbert Gutnacht, as well as physicist Dr. Renee Franzen. And obviously on this group this afternoon, we also welcome many of our laser users and doctors that have already achieved their mastership diploma in laser dentistry with Aachen University, as well as Nico, but I think he's just seeing some emergency patients with Genoa University. And then some of these guys too have also gone on to do their MSc in laser dentistry. And I know they're looking now also at what's next, is a PhD next and whatever. So we've also got some doctors on the side. I see Tace is with us, and obviously Bryan, and some other doctors who could possibly join in the conversation a bit later, or if we get some nice topics we can discuss to go into a bit of detail. But for starters, we'll let Melissa just run through a presentation, and just bear in mind this is as basic as we can try and make it, where doctors can get a bit more insight into this amazing world of photobiomodulation and how the light works. Those of you who don't know, it's also known, I think Melissa will explain, also known as low-level laser therapy or biostimulation. It comes under different names, but it appears that the world's going to try and standardize it now and call it photobiomodulation. So Melissa, thank you very much. Over to you.
Thank you so much, Peter, and welcome to everybody. I'm going to talk a bit about photobiomodulation, and I'd just like to say a special welcome to my Mauritius dentists. I'm so happy that you guys can make it. I know I've taught you this quite a couple of times, but I'm glad you're watching it again. And then obviously I've seen there's a couple of other dentists from all over the world, some doctors as well. We're going to touch on some medical and veterinary and dental. So yeah, definitely a talk for a wide range of medical practices. Okay, so let's get started. So today's focus will be obviously photobiomodulation, and we will talk about light in terms of wavelength and the significance thereof, as well as the specific wavelengths and how specific wavelengths are used to treat certain conditions, and photochemical reactions within animal cells. So we're going to do some physiology as well, and then photochemical versus photothermal effects. That's also where your wavelengths come in, because obviously certain wavelengths act on cells in a photochemical way, and other wavelengths act on cells in a photothermal way, where it's absorbed by water instead of chromophores. Okay, and then we'll just briefly discuss some clinical applications. Depending on the popularity of today's talk, we will have a 2.0 talk with my colleague Rolf Penny, who will discuss more in detail dosages and clinical applications, in more detail. So yes, hopefully we've got some good comments and things from today, so we can have it 2.0, photobiomodulation 2.0. Okay, so photobiomodulation. We are always hearing about, we've got the reps that come in that want to talk about their lasers, and they talk about all the good things that it can do in surgical. For example, the dentists, you can do these amazing gingivectomies and troughing. You don't, use retraction cord, and you've got all these amazing things that the laser can do. But very rarely they touch on photobiomodulation. They just kind of say, you can use the laser for pain therapy and biostimulation, wound healing, but what is it actually, and how does it work? So that's what we're going to talk about today. So photobiomodulation is the biochemical reactions that occur in living cells in response to light, also known as biostimulation and low-level laser therapy. So if you have to break down the word, photobiomodulation. Photo is light, bio is life, so you're living the cells, And modulation is the influence of, exerting influence on. So literally, photobiomodulation means exerting an influence on living cells through light. Okay. So there are hundreds upon thousands of studies on this topic. On PubMed alone, there are over 300,000 published papers. Okay, that is quite a lot, and that's only on PubMed. So we know that this is not woo-woo science. It's not a fad. It's not magic. You know, it's real. It is something that actually happens, that you can treat pain. You can get an anti-inflammatory effect from it. You can increase blood circulation. The studies prove that. And most of these studies are randomized. They are double-blinded, and they are placebo-controlled. So that is the golden standard of medical research. So we know it's the good thing. Okay. Definitely not magic. So in order to understand how light influences cells, we need to go back to science, to university. You probably recognize this little spectrum. It's called the electromagnetic spectrum. And the reason why I've brought this up is because light is broken down into wavelengths. So you have your short wavelengths and you have your long wavelengths. And each wavelength has got a certain amount of energy. Okay. So with your longer wavelengths, so we're talking about your infrared spectrum of wavelengths. That is your long wavelengths, and they have very low energy. So they're photons. So light cannot be described. But we know that light contains photons, okay? Pockets of energy. In your infrared spectrum, you have very low energy, less photons. But as you go down to your shorter wavelengths, you keep going through your visible spectrum, your ultraviolet spectrum, so eventually reaching your X-ray, your gamma rays. That's your very short wavelengths, and that's high energy. Lots of photons hitting your target tissues. A lot of energy. Okay, that is your ionizing radiation. Causes damage. Okay, so past your 980 nanometers, if we look here in your near infrared, in your infrared spectrum, your near infrared spectrum, you have your 980, which is around there. I don't know if you can see my mouse. I hope you can. But your 980 will lie about there. Okay. Beyond that, your cells or your body will start, or the light will be absorbed in water, and that will be a photothermal effect. Okay, and then you'll have vasodilation and microcirculation. Once you enter your near infrared and your red spectrum of wavelength, those wavelengths will start being absorbed in your chromophores, which is your melanin, your hemoglobin, your cytochrome C oxidase, oxyhemoglobin. Okay, and we'll get into that just now to see exactly what is the effect when absorbed in those chromophores. So one more thing that I would like to mention here as well is a lot of your healing lasers or lights that get used in light therapy are here in your blue spectrum. So it's usually called your blue light. It's not used that often because it's a very low energy. It's a very high energy, short wavelength. So it gets absorbed in your melanin and hemoglobin at the surface. So if you put your power density up, your power up, it tends to burn. So we would use the blue laser for wound healing and things like that. But your most popular wavelengths would occur here in your red, in your visible spectrum, in your red light. Okay, that is your 600 nanometer wavelength. Interestingly as well, the 750 nanometer you won't hear about very often. They've found that it doesn't have a very high biochemical effect on cells, so they don't use it, too often. It gets used, but you don't really hear of it very often. So your most popular is more in the 600 nanometer range or 800 nanometer range, and then from your 900 to 1,400 nanometers. Okay, and then also on that note, ironically, your red light is actually colder, if I could put it like that, than your blue light, because it has a lot less energy. So if you think of warmth, you always think of, red, and you think of blue as cold. But in your electromagnetic spectrum, it's actually opposite, because your blue light has a lot more energy. It has a shorter wavelength compared to your red light. So just a little interesting fact for the day. Yes, and then just another thing, photobiomodulation occurs within this range of 1.4 or 1,500 nanometer to around 400 nanometer, maybe sometimes even 300 nanometer, but then you're going into your ultraviolet, which is, more superficial treatments. Okay, so why are light wavelengths so important? So if we look at this picture, think of light as food, or food as light. Food gets broken down into micronutrients and macronutrients, and these get used in a unique way in your body. Protein for protein synthesis in muscles, and your vitamins for your immune system. Carbs, fats, all that get used in a specific way in your body. The same with light. When light gets broken down, each unique wavelength is also metabolized in a different way in your body. So 600 nanometer would be your superficial. It's not a very deep penetrating. It's a short wavelength, high energy. So it's good for wound healing. Okay, so it's more superficial. So acne and skin conditions and things like that. 800 nanometer is a little bit deeper than your 600 nanometers, so you can get very, very good pain management with your 800 nanometer because it stimulates the nerve endings in the dermal layer of the skin. Okay, and then you have your 900 nanometer wavelength, which is quite a deep penetrating. So there you can get your muscles and you can get deeper below your fat tissue. Okay, so it's important to know that each wavelength has a specific and unique effect on the body. So which wavelength can most efficiently produce desired results? So as I said, the shorter wavelength, less than 950 nanometer, has quite a high energy. And it's very highly absorbing melanin and hemoglobin. So to get past your melanin and hemoglobin in the top layers, you'll need quite a high power density. But when you increase your power in those laser devices, you can cause burning. So it's always good to use the right laser wavelength to the desired, for what you want to do, the outcome that you want to get. And then your longer wavelengths, which is more than 980 nanometer, you have a lower energy, and these are highly absorbed in water. Okay, so you have a photothermal effect, and you have increased circulation and vasodilation. So what is the effect of light on tissue? So each wavelength is absorbed by specific chromophores, okay, to stimulate a photochemical reaction. Your chromophores, as I've mentioned, your melanin, your hemoglobin, your oxyhemoglobin, and most importantly, your cytochrome C oxidase. If you remember from university days, the cytochrome C oxidase sits on the inner membrane of the mitochondrion. Okay, this is important in your ATP synthesis. So when we're talking about photobiomodulation, we talk about ATP. ATP is your energy of the cell. Without it, your cells cannot survive. Without your cells surviving, you have tissue necrosis. And if it just carries on, it's not good. Okay. So your cytochrome C oxidase plays a vital part in photobiomodulation. The cytochrome C oxidase absorbs the photon from the light and it kind of flips state. So it drops off oxygen, goes back, picks up another oxygen, drops it off at the ATP synthase, and it just keeps going when it gets stimulated by light. So that's what cytochrome C oxidase is probably the most important little chromophore in this whole ATP synthesis cascade. Okay. So here, just to show you again what the wavelengths and how important wavelengths are and where they are, how it's absorbed. So melanin, you can see here in your 600 nanometer range, it is highly absorbed in melanin, so it's very superficial. Okay, and here you've got a very high absorption. It's not as high in cytochrome C oxidase. Then in your 800 nanometer range, you've got a very high absorption in cytochrome C oxidase. So your cytochrome C oxidase loves your 800 nanometer range. Okay, so you know that you'll get quite a nice effect on your energy formation, production, your ATP synthesis with your 800 nanometer range. Okay, then we have our 900 nanometer range over here. So I'm actually going to mention this. Over here in the middle, somewhere over here, is your 940 nanometer. So you'll see that just before there's a major spike in the water absorption, you will find your 940 nanometer. That's just your 950, somewhere around there. So that's very good because your 940 nanometer will be favorable in all of these chromophores. So you'll have a good absorption in water, a good absorption in hemoglobin, and a very good absorption in the cytochrome C oxidase. So either one of the others have either a very high absorption in the cytochrome C oxidase or in hemoglobin, for example, here, your 900, in your 800, in your, okay, anyway, so 980 nanometers, very highly absorbed in water. As we go along, you get vasodilation and microcirculation, okay, with your water. So then it becomes a photothermal effect, as I've mentioned. Okay. So I just wanted to show you this. This is a screenshot that I took from a video because the videos tend to lag here. So I'm just going to show you this. It's quite simple to understand. Over here we have our ATP synthase, this little green thing over here. Your cytochrome C oxidase is your little enzyme over here. And then we have your respiratory enzymes, which modify your oxygen molecule to be picked up by the cytochrome C oxidase. So in normal cell conditions, or in normal conditions, you will have your blood that obviously circulates in your blood vessels, and it spontaneously drops off oxygen for the cells to pick up. And when the cell picks up the water of the oxygen, it gives off oxygen and lactic acid and all other waste products, which the hemoglobin picks up and carries away. Okay, so keep that in mind. That is important to remember. So once the oxygen enters the cell, and it comes through the mitochondrial membrane and it gets to the respiratory enzymes where it gets modified, gets picked up by the cytochrome C oxidase, gets dropped off at the ATP synthase where oxidative phosphorylation occurs. So you'll have your reactive oxygen species as a byproduct of this reaction, and you will have your ATP synthesis. Your ATP over here. So these little molecules over here, your adenosine triphosphate. Okay. So those are your byproducts from this. And you also have your calcium ions as well in this whole process that are formed, which is important in the cell membrane permeability. And also it's a very, very good neurotransmitter. So how does light stimulate mitochondria to produce ATP? So in a stressed cell, you will have nitric oxide, which binds to cytochrome C oxidase, and it halts the whole ATP synthesis oxidative phosphorylation process. And in order to get that going again, you can stimulate the cytochrome C oxidase with light. So remember, cytochrome C oxidase is an enzyme which absorbs the photons, the excited photons from the light. When that happens, the bond breaks between the cytochrome C oxidase and the nitric oxide. When nitric oxide is released, it's a very good vasodilator. So when you have vasodilation, you have increased circulation. And when you have increased circulation, you have more oxygen entering or going through the blood vessels. When you have more oxygen can be released into the cells where they are used in the oxidative phosphorylation, ATP synthesis phase. Okay, so you have a lot of energy being produced and the cells can start repairing. Also, at the same time, hemoglobin in the blood. Remember, hemoglobin is an oxygen-carrying molecule. That is also a chromophore, and it absorbs the photons from the light energy. And when it absorbs the light or the photons, it gets excited, drops off the oxygen, picks up the nitric oxide and the waste product, and goes. It moves on. And this process just keeps going. So when the hemoglobin is stimulated, just drops off the oxygen so quickly, picks up the waste product, carries it away. So now you have vasodilation, you have your hemoglobin reacting faster, you have your cytochrome C oxidase reacting faster. So you have this whole process that's just going so quickly because it was stimulated by the light, it was absorbed by the photons in light. And there you'll have cell proliferation, you'll have a lot of byproducts for the inflammatory process as well, and microcirculation, increased circulation. Okay, and then also another byproduct is, as I mentioned, the reactive oxygen species, which is good in the inflammatory process, and also it's a defense for the microbial invasion in the immune system. So very, very good for that as well. Okay. So yes, I've just basically explained all that. So not all light is created equal. Only specific wavelengths or colors can stimulate cytochrome C oxidase. So your 600 nanometers, your 1100 nanometers are ideal for photobiomodulation. And obviously within that range, some wavelengths are more favorable to the cytochrome C oxidase than others. For example, the 800 nanometer range is highly favorable, and the 600 nanometer much less. Okay. So we're going to discuss some laser tissue interaction. So how does the light reach the tissue? So as I've mentioned, light enters as photons, which are energy pockets, and photons are released into the tissue. They are either reflected, they are either scattered. So when we're talking about scattered, they bounce off the chromophores and all the other tissues and surfaces underneath, inside the tissue. Some of it is absorbed and some of it is transmitted. Okay. So here's a nice picture to really show you how that's all happening. So you have reflection over here. So you've got a loss of energy over there. And that's also, if you are doing laser treatment and you are not in contact with the surface of the skin, you will get a lot of energy loss by reflection. Okay. Then you've got your scattering over here. So the laser energy is just kind of moving in all directions, bouncing off the surfaces of chromophores and other molecules in the tissue. You have absorption. Okay. So in your 600 nanometer range, which is a short wavelength, high energy, most of it gets absorbed here in the epidermis, which is the first layer of skin tissue over here. Okay, that's where most of your melanin is. So if you want to get a little bit deeper than that, you're going to have a much higher power density. If you've got a 600 nanometer range laser, you'll have to have a very high power density to get deeper than the epidermis. Then you've got your 800 nanometer range, which you can get down into your dermal layer, your dermis. So here you've got all your blood vessels, your nerve endings. So here's you've got your nerve endings over there for axonal sprouting as well. So it stimulates your nerves to regenerate. and they've actually done lots of studies on that, and how laser energy can regenerate nerves, and the axonal sprouting on these nerves have been remarkable. Okay, so this is also a good range, the laser wavelength for IPL, so hair reduction, laser hair reduction, so your 800 nanometer range, between your 600 and 800 nanometer range, because it's very much here in your dermis layer. And then you've got your 900 nanometer range up to your 1000 nanometer range, which goes much deeper, and you've got your subcutaneous layer. Okay, that's in your fat tissue, your muscles. So you've got your main arteries, your main nerves, all your blood vessels really gets there. And then transmission is your depth of penetration. So that's how deeply laser can actually penetrate before it is absorbed completely. Okay. So just to show you this little graph again, or something similar to what I was showing you previously, just to show you the wavelengths and where they are absorbed in all the different chromophores. And this is your optical window. This is your therapeutic window, okay? This is the wavelengths which provide the best kind of depth of penetration for the best outcome, the best result. And then your best, this is also for your best desired reaction in the mitochondria, and it's here inside your optical window. So just to touch on this again, you'll see here from your 950, 980 nanometer range, it starts getting highly absorbed in the water. So from here on out, it's mainly water, so you'll have more of a thermal effect, and below you'll have your photochemical effect, so you'll have very high absorption here in your hemoglobin. So you've got your 600 nanometer range, melanin, and let's quickly see here, your 800 nanometer range, also highly absorbed in your melanin. Okay. So this is actually very, very important to remember when you are treating, it depends on what you are treating. So your physiotherapist might want something like an 800 nanometer laser for, kind of a deeper penetration, or even higher, like a 900 nanometer range laser to really get in those muscles. Whereas your dermatologists might rather go for a 600 nanometer laser where it's more superficial, highly absorbing melanin. And so it all just depends on what you want to use it for. Of course, with most of us have the Epic X, Biolase Epic X 940 nanometer laser, and you can actually see here, if I point over here, you've got the 950 nanometer over here. You can see how well absorbed it is. It's such a nice balance of absorption in all these chromophores. So you've got a very good, optical window for your 940 nanometer laser. It's well absorbed in melanin. It's well absorbed it's a deep penetrating laser as well. So you can get very good results through using this type of laser wavelength. Okay, so just to quickly briefly talk about each range. So your red light, so this is your 600 nanometer, your visible, in the visible spectrum, you've got your red light, your blue light, orange, etc. Okay, and your 600 nanometer range falls within the red light, okay, visible spectrum. You've got a very shallow depth of penetration. It's a very superficial treatment. So skin and mucous membrane. You have higher energy than your infrared photons. Very high, so you've got a short wavelength, high energy, highly absorbed in melanin and hemoglobin. It inhibits bacteria and promotes cell growth, so it's very good for wound healing and scar tissue regulation. And then these are just a couple of treatments or conditions: herpes, shingles, phagoparesis, trigeminal neuralgia, ulcers, and open wounds, where the 600 nanometer range is really good for this type of treatment. okay, or for these types of conditions. Your near-infrared light. So in your near-infrared light, we've got our 800 nanometer to about 1,000 nanometer, 1,400 nanometer range. Okay, for now, I'm just going to discuss in the 800 nanometer range. So this could be your 800 to around 880, 890 nanometers. You have much deeper penetration depth than red light, so you've got about 2 to 5 centimeters. This occurs in your dermal layer, so just below the epidermis. Okay, the cytochrome C oxidase, that very important enzyme in the mitochondrion, reacts favorably in the 800 nanometer range. Okay, increased cell membrane permeability and removal of waste products. Minimize pain signals by stimulating nerve endings. So as I've mentioned, the 800 nanometer range in the dermis, so that's where all your nerve endings are. It really stimulates those nerve endings. So you have a pain management, so less pain reduction, and also very good nerve regeneration. So you've got beautiful axonal sprouting with 800 nanometer range laser treatment. And then, yeah, so it can be used on tendons, skin conditions, herpes. And it's just also important to note that it's not limited to these treatments. You can always, as I said, if you've only got a 600 nanometer laser, you won't be able to do deep tissue treatment, for example, in muscles. But you can go into the dermal layer, so you can go to the nerves and your blood vessels, but you're going to need a very high power density to be able to do that, because all your energy is being absorbed at the surface. Okay, so in that case, you might actually risk burning the patient. So you don't want to use a high power density, but it is possible. Okay, you just need to get your doses correct for that. So it's not limited to these treatments. Okay, and now we've got our 900 to 980 nanometer range, so it's much deeper penetration depth. So you've got about 3 to 5 centimeters or even more. Okay, especially if it's a pulsed laser, then you can get really deep, because it's with every pulse you're just increasing the. It's kind of like how can I explain? It's like giving treatment for laser therapy with it's cumulative. So with every treatment dose, the next one will just add on to the previous one. But we'll get to that a little bit later on in the presentation. So with a pulse laser, it's pretty much the same. It's cumulative. So the energy goes with high peak power, goes into the energy into the tissue, then it relaxes. Then it shoots another peak power of laser energy through those tissues. Those photons just shoot through the tissue, and it just keeps going. It's cumulative. Okay, so you can actually get quite a deep penetration depth with a pulsed laser. Okay, and then your 900 nanometer to 980 nanometers in your subcutaneous layer. You have enhanced oxygen delivery. So again, it is well absorbed in hemoglobin, so it stimulates hemoglobin to drop off oxygen. It is absorbed in the water in the blood vessels. So it increases microcirculation and vasodilation. So you have a photothermal, and it heats up the blood vessels. Okay, so once it absorbs the water, it heats up. So you've got a very well. For example, if you're treating a TMJ, then your patient will feel heat. Some of it is absorbed in the melanin, where they'll feel the heat, and other parts of the photons are absorbed in the water. Okay, so it's also it falls in that perfect wavelength or in the spectrum where the wavelength just starts to being absorbed by the water. Okay, so hemoglobin absorption peak in the 980 nanometer range. Increased oxygen deposit into nearby cells, as I've just mentioned. Increased water absorption, so you'll have a photothermal reaction. And then this is more for your deeper concerns, like of your back and neck and shoulders. And yeah, just more your muscles and really getting into those tendons that are quite deep. Okay. So this is just a picture to just show the wavelengths and the penetration depths. So you can, so you can actually just get a visual of what I was just saying. So the 600 nanometer range will be here, your purple, the purple light, I guess. Okay, so you'll see it doesn't go much further than your epidermis, and your 800 nanometer range goes just here into your dermal layer. So you can see with your pulse, your IPL lasers, it's a pulse laser, you can really get into these hair follicles and get your hair removal done quite nicely. And then your 900 nanometer range goes even further, goes deeper into your subcutaneous layer. Okay. Your treatment parameters. So this is very important when working out your dose for your patient, working out your how many treatments your patient's going to need, the type of injury your patient has. You need to know all this: wavelength, power density, energy density, to be able to treat the patient properly. Because if you give them the incorrect dose, you can either overdose or underdose, and that is not always ideal, because if you overdose, you actually have an inhibitory effect, or you can have a negative effect. If you underdose, nothing is going to happen. So it's important to keep all these things into consideration. And also contact versus non-contact treatment. That is very, very important when considering, whether you are treating a wound or if you're treating a very deep injury, as for example, a sports injury. Okay, and then treatment frequency, how often you are going to be treating your patients, and then continuous wave versus pulsed. So as I mentioned, with the pulse laser, you can really get much deeper penetration than with your continuous wave. With continuous wave, you'll just need a little bit more time and patience, but you can still get the same results. Okay, and with saying that as well, it also depends on the size of the handpiece that you are using. So obviously, if you're using a very small handpiece for a large wound, it's going to take you forever to treat it. So it's also very important. I actually didn't mention it here, but or you can actually consider it as power density or energy density. So it depends on the size of the handpiece that you are using to treat the area of injury on the injury site. Okay, so power, just to briefly go through these, some physics. Power, your watt is the rate of the energy that's being delivered. So 1 watt is 1 joule per second. So how many photons travel per second? So we know that your shorter wavelengths have got a lot of photons, and your longer wavelengths don't have as much photons, but your longer wavelengths can actually penetrate much deeper, because they do not have such a high absorption in the superficial chromophores as the lower or the shorter wavelengths do, such as your 600 nanometer. Okay, so this is very important. Your energy density is your joules per centimeter squared, so that's your dose. If you think about your tap and you want to fill a glass of water, and you just open it, you have little drops coming up. It's just filling your water, it's filling your glass, but it's going to take you the whole day to fill it. But if you open the tap, there's enough water coming through, you can fill that glass within 5 seconds. So this is where your energy density is important. So you need to be able to give the right amount of dose per square centimeter, per that area that you are treating. So for example, if I'm treating a 5 cent, or say a 7 centimeter square area, and I use this handpiece, okay, it is tiny. I don't know if you can all see, if you just look at the video for a second. This handpiece is going to take forever to treat this size, okay? It's going to take you a very long time. But if you use this size handpiece, okay, treating that same 7 centimeter square area It's going to take much less time, okay? But if you use something like this with a larger surface area, and you're treating that wound, which is over 7 centimeters square, this will take you even faster than the other two. So that's very important to remember. It's the size of the handpiece that's delivering the energy. Okay. And also, if you're using a smaller surface area, your penetration depth is also going to be much less compared to your larger surface area. Okay. Cool. So in order to work out your dose, you need your treatment time and your laser power. But usually we already know what dose we want to give to this area. If it's a wound, we want to give it some biostimulation, so we will give it about 6 to 8 or between 2 and 8 joules of energy, or joules per centimeter square. So we already know the dose we want to give it. It's the time that we want to know. Okay, so we know with all this, we know what the laser power is because we know what size the handpiece is. Okay, so we know this is a 2.8 centimeters square handpiece. So our treatment over here is if we're just going to keep it in contact, it's 2.8 centimeters square. If we want to treat it, if we want to give it 8 joules, we're just going to say, okay, how long am I supposed to treat it for? So we've got our dose and our power, so we just plug that in, dose divided by power, and we will get our time and how long we should be treating that area in contact, okay? So usually we do know dose and we do know power. It's usually the time that we are uncertain of. So there's a nice little formula for you to use. Okay, so power density determines the dosage, and low power means longer treatment time. But you also don't want to increase your power too much in case of burning your patients. Okay. So contact versus non-contact. This is very important. In contact, you can get a much deeper penetration. So you want to treat deeper issues, deeper complications. So if you've got a muscle injury, maybe a sports injury, so you will always want to be in contact for those types of injuries. Okay. When you're in contact, you will also apply some pressure to compress the superficial tissue. This minimizes reflection. Remember when I spoke about laser energy loss with reflection? So in contact, so if we're keeping it in contact, it will reduce the amount of reflection. So it will reduce the amount of energy lost. Tissue compression. So if we are applying the laser energy and we're applying some more pressure, we are actually shortening the distance to the target tissue. And at the same time, that pressure will also kind of block the blood vessels from, then the blood's not actually going through, and that prevents the blood from being absorbed from the laser. Because, at the end of the day, blood or hemoglobin is a chromophore and it is absorbed. So the less blood in the blood vessels, the more absorption at the target tissue. Okay, so that you're not losing energy through absorption in hemoglobin. Okay, in non-contact, that'll be your superficial wounds, your skin diseases, your skin conditions. So yeah, photons are scattered and reflected. We have a higher energy density is required to reach deeper tissues. So if you want to be in non-contact, but you still want to reach your muscle tissue being in non-contact, you will need a very high energy density. So you'll need to put the power up a little bit to be able to reach those deeper tissues. That's pretty simple to understand. So then the other thing to remember when using lasers is what do you want to achieve? you want to achieve biostimulation, for example, wound healing? Or do you want to get analgesia and get an anti-inflammatory effect? So with these, you need to remember that there are different energy densities or doses that you need to apply, because the cells react in a different way to each of these energy densities or these doses. So for pain and inflammation with the 940 nanometer laser, you'll need around 15 to 30 joules per centimeter square. Okay. And for biostimulation, cell repair and regeneration, you have 2 to 8 joules per centimeter square. So it's also important to know that with your lower wavelengths, so your shorter wavelengths, so in your 600 nanometer range, a lot of the energy is already absorbed in the surface layer of the skin. So you'll need a much higher energy density to reach lower. Okay, so for example, for biostimulation, or beneath the epidermis or within the epidermis and not completely superficial, for 600 nanometer range, this energy density over here will be much higher. The same as with the 800 nanometer. You'll have slightly more joules per centimeter square to get slightly deeper or to get a biostimulatory effect. Same thing with the anti-inflammatory. 600 nanometer, you'll need a lot more, you'll have a higher energy density, so you'll have a higher dose. Actually, with the 600 nanometer, let me rephrase that. 600 nanometer cannot penetrate so deeply to really achieve this result. So for analgesia and anti-inflammatory responses, we will mainly use your 800 or 800 to 1400 nanometer. Okay, just to clear that up. So 600 nanometer doesn't really work for pain and inflammation, or for pain therapy rather, not inflammation, for pain therapy, because it doesn't penetrate very deep. Okay. Some clinical indications. So the conditions do not absorb light. So we know that. Conditions don't absorb light. It's the photoreceptors and chromophores that absorb the photons in light. So dosages are important. You can underdose or overdose, as I've mentioned. And interestingly, if you have optimal conditions in the cell, so your cells are healthy and you know everything is going as it should, ATP synthesis is perfect, everything is fine, you've got optimal conditions. If you have to do some laser stimulation, you're not going to get some Superman type of cell reactions going. You can't stimulate something that's already optimal. So that's just something to remember is if your cells are healthy, you can't stimulate them to be more healthy. You can't create a more optimal condition within your cells. It's only when the cells are under stress and that it will actually create a response. Okay.
Thanks, Melissa. So I just wanted to just ask one or two questions to some of our panel here that are using this particular wavelength, the 940, the BioLaser Epic, quite regularly. I see a question has come up too about using the formula for the doses, so we can send that formula to the people afterwards. We don't want to spend too much time, however, on this kind of presentation going too much into the formulas and dose, because it is very important to understand which wavelength you're working with and everything as you've discussed in how what absorbs it. So if you're treating something, for example, I've often been called in panic by maxillofacial surgeons that have either placed an implant or extracted a lower 7 or 8 and hurt the alveolar nerve, and the patient has got sort of paralysis of the lip and the cheek and the tongue. And then you read in the articles that you must apply a dose, for example, of 5 joules per square centimeter. But that's normally at where the injury is, so on the nerve. So what they tend to do is often put the laser light, on the cheek or inside the mouth, and they're getting 5 joules per square centimeter on the surface, but then it's going through the tissue, and by the time it gets to the nerve, it's actually far below 5 joules per square centimeter. And then they say, this low-level laser therapy doesn't work. It's not, no, it's because they've applied the wrong dose. So it's important when you read the studies and the articles, Generally, it's about 4 or 5 joules per square centimeter, and we're giving a dose, which just means that the amount of wattage at about half a watt per square centimeter at a time. So it's a very low energies going through, but you need to know whatever you're trying to treat. If it's on the surface, it's quite easy because it's right there where it's being absorbed. But if it's deeper lying tissues like trigeminal neuralgia or alveolar nerve damage and things like that, it's important to know that that dose of 4 or 5 joules per square centimeter must be at those nerves. So you have to consider what is the depth. So you need to know your anatomy quite well too. As the light's being absorbed, do I need to penetrate 1, 2, 3, 4 millimeters? And it's very difficult to say, once again, exactly, because what is the color of the skin of the patient that you're actually treating? Is it dark skin, African, or is it somebody from the UK who hasn't had much sun, and then the light can penetrate deeper because on the surface the skin is very light. So same applies to TMJ and things like that. So Bryan Sher, Bryan has got the mastership that he did with Aachen University and the MSc. And Bryan, if I could just bring you in, a couple of years ago when we met, or more than a couple of years ago, many years ago, you were just a normal dentist. And then obviously you got your lasers and now you're a super dentist, So as a super dentist, with all this laser information and knowledge, I'm sure you've got a testimony or two for us of where you've used biostimulation or low-level laser therapy, or otherwise, as it seems to be known now, photobiomodulation. So maybe if you can just quickly give us 1 or 2 testimonies where you've used this on either a nerve injury or something to do with this, and the response that you've had and the results that you've had. Thank you.
Thanks, Peter, for the kind words. But it's not an event that I've used it here or I've used it there. I actually use, I'm not talking about lasers in general, but specifically photobiomodulation. I think I use it on a daily basis. I use it all the time. Most of my procedures that I do, I follow up with photobiomodulation. If I do an extraction or an endo or anything really, any surgical procedure, I use photobiomodulation. And it becomes part of your dental practice. It has to be next to you all the time, ready to use. And I've now my scope has broadened probably out of the realms of dentistry to, I've treated a couple of friends already with fractured ribs that just wouldn't heal, and I gave them a couple of treatments of photobiomodulation on their ribs, and they were instantly better. I just followed them up. After the first visit, they were taken out of pain. I've used it on tennis elbow. I've used it on golfer's elbow. I've used it on fungi on toes. I've used it everywhere. I'm currently doing my pets with it, their ears on my one pet. So photobiomodulation is really, the patients call it a magic wand. I do all these TMJ treatments. We're getting back to clinical work in the surgery. TMJ treatments are fantastic with it. It relieves those symptoms almost instantaneously. And I normally place the patients on a series of treatments, and they never really complete them because they're cured and they don't really need to come back to follow up on a long-term basis. Normally 1 or 2 treatments and they're feeling much better. Obviously with TMJ, you've got to treat the cause, the etiology of the complaint, and not just the pain. But a lot of the time, just by doing PBM can help those patients immensely. I'm just thinking all day I use it for everything. So I think having a diode laser is a must-have in a practice, and certainly a practice builder. And the PBM, of course, I'm just now trying to rack my brains for specifics, but as Melissa was rightly saying, for the herpes and the aphthous ulcers and the healing, the tissue trauma, that's absolutely fantastic. The healing is so much quicker, and it's noticeably quicker, and the patients notice it, and they're the ones who end up coming to request photobiomodulation and treatment. How's that?
Thank you, Bryan. Perfect. I think thank you. We find a lot of dentists too, and even ourselves, we've got, we take the laser wherever we go on holiday. At home, I've actually got one. This is called the Epic S, but it's just...
Likewise, mine's at home here treating my animals and me.
So my wife, also being a medical doctor, she uses it also for things. She's even used for scar treatment and stuff like that. Less scarring if you just sutured up a patient too, and things like that, as well as things like, just abscess, ulcers, cold sores, also warts with the virus on the kids and so on. It works extremely well for that. So multiple users. We've also got physiotherapists using it. And if you do some more research, you'll find that the guys are also using it for treating conditions like Alzheimer's and Parkinson's, helping the neurons fire better and so on. Because I use it for my hair growth. I think a couple of years ago I was busy going bald. It looks like I've managed to keep stimulating my hair to grow. But I wanted to make sure that while I'm stimulating my hair, I'm not frying my brain cells. So I was forced to look a bit deeper to what the other professionals are doing in terms of low-level laser therapy. And we see in these kind of treatments, and I think we're going to see more and more of it come into mainstream medicine as well, hopefully, pretty soon. So Melissa, over to you to continue. Thank you.
Thanks. Okay, so we're almost done. So just bear with me for a few more minutes. And we're just going to touch on some clinical indications. Just to mention again, depending on the popularity of this webinar or this talk, my colleague Rolf, who's very knowledgeable in the doses and treatment times and all these things, we will most definitely have another one of these talks, if you demand it. So where we go into more detail on these doses and treatment times and the clinical applications and. Okay, great. So clinical indications, as I've mentioned, dosages are very important. Clinical contraindications, not suitable for tumors and eye treatments. So very important to always wear your safety glasses when doing any treatment of patients and yourself and for anybody in the room, because remember, it's a pigment-seeking laser, as I mentioned. So when this laser reaches your retina, remember there's pigment in your retina, it can cause irreversible damage. Either you'll be blinded or you'll be seeing spots, little stars for the rest of your life. So that's irreversible. Very important to always wear your glasses. For tumors, because of the biostimulatory effect, we're not 100% sure the effect of lasers on tumors. So we always just advise, and studies advise to rather not treat over, tumors. You can remove benign growths if you find a benign growth in the mouth. If there's something that you are unsure of, rather leave it and send it for proper, rather send your patient to get the proper treatment or removal instead of with the laser, because like I said, we're not sure exactly what the effect is of laser on tumor because of the biostimulatory effect. But we've had many clinicians removing growths and things in patients' mouth, but creating an extra little border around it and not getting any close to the actual tumor site. So that is possible, but not recommended. Safe to use on patients with pacemakers, unlike the electrosurge. It's safe I'm talking about surgical procedures now. If you are doing photobiomodulation, it is safe to use on patients with pacemakers. It's safe to use on pregnant women as long as the abdominal area is not irradiated. Okay, and it is safe to use a pulse laser on epileptic patients. There have not been any studies that have shown to evoke a epileptic seizure on epileptic patients using a pulse laser. And then it's also important to avoid large doses over the thyroid because the thyroid is light sensitive. Okay. So treatment frequency. So how often should you be treating your patient? Every second or third day for the first 2 weeks at the start of treatment, and then thereafter once a week for another 2 weeks, and then the patient will actually just come back when they've got pain. You just charge those treatments. Okay, but they usually don't come back after the 4th or 5th treatment anyway. And also just remember that the laser will only relieve if it's just a pain, for example, a TMJ problem. That's the easiest to understand. if you have a patient with a TMJ, but there's an underlying problem, if the patient is, grinding their teeth at night or under a lot of stress, and that is what's causing the TMJ or the tightness in the jaw, the laser will help to relax the muscles and increase the blood flow. Everything will be fine for the moment. But that night, the patient goes to sleep and they're grinding their teeth again, or they're under so much stress still from work, it's not going to help it. The laser is not going to help it over time. So it's always important to first identify the underlying cause and use the laser to ease those symptoms. But if it's something like inflammation, you can definitely help with the laser. Will definitely help with that without using any medication or anti-inflammatories for that. Okay. So laser treatment is cumulative, as I've mentioned earlier. One dose, so today's dose, if you do another dose tomorrow, just folds on from that. So you don't want to overdose, because if you overdose, you'll get an inhibitory effect or a negative effect, and you don't want that. So it's always good to spread your treatments out. If we're talking about skin conditions, we advise daily treatments, but it's a low dose. So skin conditions are usually treated daily. Okay. Acute conditions respond faster to treatment. And chronic conditions, this is actually quite interesting, and it's important to tell your patients this as well. If your patient has a chronic condition and you're treating with laser, you can advise your patient that they may feel worse after treatment, but that is only because they are going from the chronic stage to the acute stage, and then healing can begin. So it's not laser damage or this isn't working, it's just making it worse. It is normal. It's actually a positive reaction. So it's or a positive response. So always remember, if you have if your patient's got a chronic condition and you've treated it and they feel worse, it's okay. It's actually good. They're just going from chronic to acute and into the healing stage. Okay. So just to advise them of that. Okay, so some medical applications. You'll see here neck, head, shoulder, wrist, hand. All of these things, tension headaches, TMJ disorders, trigeminal neuralgias, where more of your dental conditions will come in. And then also your neck injuries. So medical applications relieve pain levels, repair tissue damage, accelerate the healing process, increase circulation, decrease inflammation and pain, and then management of chronic and acute pain. So can be used by physiotherapists, chiropractors, medical doctors. The list goes on. Okay, so this is actually a patient of Dr. Jacques Ferreira. Him and Peter actually did some work in, I can't remember the area, a couple of years ago. And they had a patient that presented, they suspected was a spider bite. And this was the wound for about after a week since the bite. Okay, so it was quite bad. They apparently wanted to even amputate the hand. It was just not getting better. It was starting to rot. It was just not good. And fortunately, Peter and Dr. Ferreira got there just in time, and they irradiated the area over here with the laser, quite a low dose. And this was after 24 hours. They irradiated again, and that was 48 hours, and again, and that was 72 hours. So within 3 days, we already had such a beautiful improvement with this laser, with wound healing. This is the 940 nanometer laser. So all is possible with the different wavelengths if you have the correct doses. Okay, so this is very important to remember. Your doses are very important to remember. Okay, and then this is about 4 months after the patient sent a photo, and this was about 4 months after the initial injury or spider bite. So it was it's a very nice healing, and you can also see the scar tissue, very minimal because the laser also stimulates collagen and elastin. So very, very beautiful healing. Okay, and as Peter was saying, he was stimulating his hair follicles, and this was his result with the laser, the 940 nanometer. So very, very cool results. His hair color even changed, so you get some life back into those hair follicles, which is awesome. Okay, some veterinary applications, very, very good among the vets. They use it most commonly in skin conditions to treat dermatological symptoms, soft tissue damage, post-surgical treatment. But I mean, it's not limited to these. I mean, you can treat the muscles and all kinds of things. So I've actually been treating my little dog who just went in for an operation last week as well. So her wound is healing up very nicely. And then this was a horse that Peter treated. There was some infection over here, as you can see. Peter, how long after the first treatment was this last photo taken?
Yeah, that's the first photo, top left. That was taken the day I arrived. This was the owner of a horse who phoned because she'd been spending a lot of money on treating this horse. It was like part of the family. I think this horse was about 14 or 15 years old. And she was a lawyer, and the vet was charging her about $1,000 a day in the vet hospital to look after daily wound dressing and the normal antibiotics and everything for about 3 months. So I said, sure, I'll come and have a look. And what had happened, the vet had extracted some teeth from the horse, and below some of the teeth, it went right through the hole, right into the nose, the cavity, the sinus cavity. So as the horse was eating and food was coming out the horse's nose. And anyway, after about 3 months and daily wound dressing and antibiotics, and a lot of cost, obviously, this horse was just getting worse and worse. You can see with the top 2 photos as well, the horse's eyes. When I got there, that horse was ready to give up, and they were contemplating. The advice from the vet to the owner was put the horse down. So she said she really doesn't want to. She heard about this laser. Can we give it a try? So I said, sure. So that hole in the top left, you'll see there was actually sort of air coming out there. It was right into the horse's sinus cavity area. So I took the endo tip, the long 20 millimeter, the longest one we've got anyway, although I could have probably in second thoughts used the ENT tips that are much longer, up to 20 centimeters. But we used the typical endodontic disinfection tip, and same protocols. Stuck it right in there deep as I could, activated the laser, circled it around, and slowly withdrew it for about 5 seconds each time, and did that, I think, 4 times. And then put on the big handpiece, like the big one you showed earlier, and gave it a dose on the outside, knowing that it needs to go in a little bit deep, and the horse's hair was quite dark. So I think my initial dose was about 12 joules per square centimeter, knowing that on the surface it's a bit more than 5, but I wanted to get it in, obviously starting with a bit more on the surface. And then 24 hours later was the second photo, and then another 24 hours. So each photo is basically 24 hours apart, except there was a Sunday in between. So I think after the third photo, there was an extra day that wasn't treated. But essentially that's, if I remember correctly, it was the first photo when I arrived, and the last photo was 7 days later. So you can see a beautiful healing. And the horse, when we got there, I think about day number 3, we actually had to start putting a rope around it because it wanted to play. It was feeling much better. Its whole immune system had restored so much better. And that's where the lasers come in so amazingly too, because we're talking about the COVID-19 and all this. If your immune system is stronger, your body is able to fight infections and diseases so much better. So especially in dentistry, the oral cavity is so important when we're talking about periodontal disease and so on. The lasers are exceptionally good at fighting bacteria and obviously certain viruses as well when we're talking, cold sores, all these other types of things, and fungus as well. So if you've got a healthier mouth, you're generally going to have a healthier body, and you've got more antibodies to fight back against various diseases. So we could see within 2-3 days this horse was feeling so much better and really wanted to play with me. So I needed a second person to help me hold the horse while we were actually treating it. And important thing too, you only see in the third photo the eyes were covered, but obviously during every treatment we covered the horse's eyes as you would in a case treating patients. A very important with diode laser, make sure there's eye protection. Okay, thank you.
And here is my colleague Rolf treating a dog as well. This dog, I actually don't think I've had it the other, no. So this dog was very injured. All his legs were just, this poor dog was in so much pain. And then Rolf came to the rescue, as always, and he was treating this dog, and this dog is happy and running around, and shame. And I even think it was his front legs that were broken as well. So Rolf was treating basically this whole dog's body, And because it's actually a very, very nice story of this dog. So, but it's just to show you all the kinds of treatments, in veterinary that apply. So open wounds, muscular pains, inflammation, all that. Okay, and then in dental applications, relieve pain levels, pretty much the same as medical. You've got your TMJ, you've got your nerve regeneration. If you've injured the alveolar nerve during an extraction or whatever the case may be, you can do some beautiful nerve regeneration with your laser. You could get bone regeneration if you've done an extraction. You can get some bone regeneration, wound care, and then obviously you've also got your ortho pain management. So if you've got your patient who's just recently put their brackets on and it's just super painful, you can apply some laser energy to the area and it will relieve your patient of immediate pain. And then at the same time, you can also induce faster ortho movement without, the negative side effect of teeth moving too fast, because you've got your increased osteoblastic cells from the laser stimulation, and you've also got collagen stimulation and all this. So with the laser, you can prevent root resorption as well in dental, and necrosis, bone necrosis. So that's also some good or some positive things with the laser in dentistry. So once again, relieve pain levels, repair tissue damage, accelerates healing. And then, as you can see here, these are just all and it's not even limited to these treatments. It's just, photobiomodulation is honestly, it's endless. So it sounds like magic. It kind of is, but unfortunately, science takes the magic out of magic. It makes it boring. But that it is just amazing. Okay, so here is a hemangioma. Remember, that is all blood. So the laser gets absorbed. The photons of laser get absorbed in the blood, and it just disappears. This is also another beautiful case. Here's another one. Lovely. Okay, and then here's just an example of treating pain and for ortho treatment for movement. Okay. And that's it. Thank you. I didn't want to keep you too long. So if you have any questions, I'm sure there have been quite a few, and we will get to them. Dr. Bryan, Sher, if there's anything you'd like to add, please do. Please feel free. And yes.
Yeah, thank you very much, Melissa. We appreciate it. And Bryan, I'll let you with Melissa close. Thank you, guys. Well done.
No, really, I can't add much to that. That was fantastic. I think you covered everything in detail. And if I wasn't a photobiomodulator, I would certainly start today. Thank you.
Pleasure. Yeah.
Okay, Melissa, we will chat to you afterwards, but thank you very much, everybody, for participating. If you have got any questions, welcome to email SciVision as well. It's info@scivisionmedical.com. And those of you obviously know our various people around the country, CJ in Pretoria, Ralph, Johannesburg area, in Durban, Renzo in Cape Town area, Melissa in Mauritius and the other islands, and obviously other doctors from other countries like Denmark, Norway, and Sweden, which we also handle as SciVision. You can also direct those questions to info@scivisionmedical.com, and we will get back to you. Or you can call any of us if you've got our contact details, or we will come and see you as soon as we can, as soon as the lockdown's over. And if any of you haven't got a particular laser and you are in the regions that we operate, we are more than willing to come to your practice and help you treat some of these cases so you can see for yourself that this is not voodoo or monkey science or something, but it is real science. If you get the dose right, using the right wavelength and the correct settings, you have amazing results where the body can literally fight and heal itself just through using light correctly. Thank you, Marissa. Great job.
Thank you.
Thank you, everybody. Have a good evening, good afternoon. Cheers. Bye.